All right, so my name is Dr. Raul Vazquez. I'm the CEO and a provider here at G Health Enterprises. The question has been asked, why do you do an annual exam? What's the importance of it? So I think the importance of it is a way for the patient to connect to a system, and also a way for the physician to connect to the patient. So it's a great time to really review some of the history, see what the actual patient's been exposed to, make sure that vaccinations are up to date, because that's the perfect time, and also look at if it's a male, female within the age group, what are the required screening tools that we should be doing. So over the age of 50 to 75, male, females, colonoscopies. That tends to be a very difficult thing to get done, but it's real important to, if you're seeing them once a year, a way to do that. Mammography, very important, often is a problem, and it's a way for us to kind of check the patient with vital signs. So the vital signs tell us a lot. We've got patients that come in and sometimes didn't even know that they had high blood pressure, and you're able to pick it with that reading, and you may not need more than one reading, because I mean, if you've got someone that comes in with a 210 over 140 blood pressure, they're hypertensive, and you could check it at a later time, but you're also going to run into that issue. It's a time that we would assess the patient for other things during the physical examination, which often can pick up things that they may often find not to be as important, but they lead us to different diagnoses. And based on some of these things in the history, a lot of us like to kind of get annual blood tests on individuals. And what we found with the blood test sometimes is, again, you have people that didn't know they were diabetics and they end up having an elevated sugar, or a cholesterol that's elevated, or a thyroid function test that were abnormal that they really didn't know, or kidney conditions that they really didn't even understand what were going on. It might have been caused by something they did or they were taking. So that annual visit is that important, and I think when they come in trying to tackle not just the encounter, because sometimes patients come in for that annual visit because they feel a sore throat or having cold symptoms. This is the way to kind of go after the preventive measures, and if you find chronic disease measures, also focus in on that. The last component of it that we don't do enough of is really assessing the patient's health literacy level. You've got some individuals that may not understand all the things that you want to do, and you want to classify or at least put these patients in a category where they may need an extra care coordination, where if you find that they need a colonoscopy and it's been someone you managed in the past and they don't get there, is having a care coordinator kind of involved with that. And the biggest piece that I find that we've been engaged heavily in is the wellness component. A lot of BMIs that get taken on the vitals, a lot of patients are obese, and you're giving them a game plan as to really how they work on their wellness side, which is quite important.